Do we emphasize abdominals or do we emphasize our lumbar erectors? First, need to understand what exactly happens during both of those movements. All right, so if we are doing a crunch, so if our spine is flexing, all right, so if we're doing a crunch this way, okay, what's going to happen is this space, so this foramen here is going to increase. All right, so this space increases when we do a crunch. All right, conversely, if we were to do back extension, this space is going to narrow. Okay, so this space gets smaller. Now, if we know we have spinal stenosis, so you can see the bone spur formation just along the foramen there. If we narrow that space even more, we're going to cause more compression. We're going to cause more pain. All right, so we need to emphasize opening this space by strengthening our abdominals, and that will help take some of that pressure off of that spinal cord. All right, so not all back pain is treated the same. It's the exact opposite for someone that has disc herniations. Reasons are a little bit different, but point is you can't treat all back pain the same. Okay, you can't say, oh, you have back pain, okay, you need to strengthen your back. It doesn't always work like that. All right, so your goal is to first know what you have. So you have to know if you do have anything going on with your vertebrae, with your spine, and you need to have a plan of action. Okay, you need to know what you need to do in order to eliminate that pain instead of making it worse. All right, so I just wanted to make a video. I'll make another one talking about disc herniations and the same kind of thing, but it's important to really start understanding how your body works, what happens when you do certain movements. That way you can start taking preventative measures going forward. All right, hope that helped. Disc herniations. Do we emphasize back extensions or crunches? Let's see what happens with the disc herniation. All right, so with the disc herniation, the disc itself tears, and the nucleus within that disc, it protrudes outside, and it can compress that spinal nerve, which can cause a numbness and tingling down your leg, back pain, hip pain, whatever the case may be. All right, so with that being said, if we are in a flex position, so if you're sitting down and you got bad posture like you probably do right now, what's happening with this nucleus is it's getting pushed posteriorly. All right, so when we are in a flex position, that nucleus within inside that disc gets pushed posteriorly, and it can cause that added compression on that spinal nerve. All right, conversely, if we do a spinal extension right there, we are moving this nucleus anteriorly, so we are taking pressure off of that spinal nerve. All right, so we definitely want to make sure we are emphasizing our back extensions, strengthening our lumbar erectors, so we can start moving that nucleus anteriorly and take compression off of that spinal nerve. All right, so disc herniations, back extensions.